Well, howdy YouTube family. It is Bolt CRNA coming to you again with another day's topic. Today we're going to be talking about how much a nurse earns in the United States of America. I know everybody wants to know what's that dollar amount that a nurse earns, and I worked as a nurse for 4 years, you could say I'm a nurse anesthetist now, or CRNA, and I can talk a little bit about my salary too. So we can go the whole spectrum from LPN to CRNA and talk about what you can earn in there. Let's get into it. Now, from my travels across, the world and meeting lots of different people in Australia and other first world countries, other nurses that I've interacted with, I have found that the US pays our nurses really well. Like, the nursing field, not only is the autonomy much higher in the US for a nurse than everywhere else, and when I say nurse, I mean RN, LPN. When I'm talking about CRNAs or nurse practitioners, I'll use that title specifically. But when I'm saying nursing, I mean just a general nurse, bedside nurse. The autonomy and the ability to upward climb and the professional development that you can have in America as a nurse is unlike anything I've seen in any other country. It's truly a special thing, and I believe that's why we have so many nurses from other places, especially like the Philippines. That seems to be a hot spot for people to come from the Philippines to come to America and become a nurse over here, because this is just a place where you have just this upward mobility in the nursing field that I haven't seen anywhere else. We also have quite a few rules and regulations that protect nurses. I will say I have worked in some states. In fact, my original job that I had as a staff nurse in the ICU in Alabama definitely did not have as many rules protecting us and keeping us from, burnout and stuff. But I've also worked in places like Connecticut, Texas, California, and other states. So those places did have, especially California. I'm just telling you, if you're a bedside nurse and you're not living in California, you're doing it wrong. Because California, it's crazy how they treat their nurses there. It's like your royalty if you're an RN in California. And they pay them extremely high, and they have so many unions and rules and regulations and guidelines. When I worked here as a travel nurse in California before I went back to school, they had like a yoga meditation room at one of the facilities I worked in off the ICU. So you could take your like mandatory breaks that they gave you all throughout the day. You could go hang out in the yoga room and just like meditate and relax for a little bit. So yeah, I'm just telling you, nurses in the US, they've got it spoiled, especially in California. But let's talk a little bit about salaries. So we're going to start at the bottom. Now, I'll tell you, these salaries come from payscale.com. I tried to look around at different websites that gave me an accurate idea of kind of where the median from the whole US, the salaries might be, and payscale.com seemed to be the closest to accurate in my opinion. Of course, keep in mind, these are taking salaries that are from, Tennessee, Georgia, Alabama, which is going to be like your lowest paying places, and mixing them with your people who are in California, Seattle, whatever, New York City. And so these are the high end spectrums and the low end spectrums, and they're merging them together in median. So if this number seems lower to you because you live in California, it's because this is the median. And if you're saying I live in Alabama and I don't make anywhere near that, it's because it's the numbers over in California is pulling you up, okay? So keep that in mind before you get upset at any of these numbers. This is a median, and the US is a very large place, and there's definitely a wide spectrum of cost of living areas and salaries. So we're gonna start with the certificate program, which is the licensed practical nurse, or also called licensed vocational nurse in some states. And this is the most basic entry-level area of nursing that you can work in. This is not even an associate's degree. This is like a certificate program. And I have some really good friends that are LPNs. This is really a great option if you're looking to not do too much schooling and you just want to get in there and want to help people, and you have that desire to get in there and put hands on people, but you're not looking to do anything too advanced or too much more than that, then this is a great option. And the median salary is $51,000 a year. And that's pretty good, I would say, especially if you're not even talking about an associate's degree, and that's just a certificate program from a community college, and you can make $51,000 a year as a nurse, as an LPN, that's good. You know, in other places, I will say the thing about being an LPN is there's a lot of restrictions because it's not even like an associate's degree, and the licensure and abilities for an LPN are pretty restricted. There's lots of states where they can't do certain things. They can't push IV drugs, they can't hang blood products, they can't do admissions assessments. A lot of hospitals don't really hire LPNs anymore. They used to, even as far as 10 years ago when I got into the nursing field, hospitals still, you know, were pretty frequently hiring LPNs. But over my career in the field, I've watched as they've slowly pulled them out of hospital settings, and they pretty much work in doctor's offices doing, you know, some of that stuff, clinic work, and they work in long-term care facilities and, you know, nursing homes. So if that's not an area that you want to work in and that doesn't sound exciting to you, I would skip the LPN. I would not do this plan because I don't think you would be happy in this position if that's not what you're looking for. Now, next step up, you have your associate's degree in nursing, and I just go ahead and do a / Bachelor's of Science in Nursing, because both of these, whether it's an associate's degree in nursing or a Bachelor's of Science in Nursing, they in general pay about the same. There are some academic hospitals that will only hire BSNs, and there are some other hospitals that I've come across that give you like a couple dollars more an hour if you have your BSN versus your ADN, but in general, the pay is going to be around the same, and the role is pretty much the same. If you're working as a bedside nurse, the role is going to be the same whether you're an ADN or a BSN. And the average salary for this role is $71,000. And I will say that seems to be about accurate from when I worked, because I worked in Alabama, which is like a very low paying state, and I worked overtime, I picked up some extra shifts, I worked pretty hard. I made like $58,000 a year. Then I went to California and I made, well, I was a travel nurse, so I made a little bit more. But let's say I was a staff nurse, like my friends who are staff nurses, you know, $100,000 a year as a staff nurse over there. If you average those things together, those two extremes, it does come out to around $70,000 or so a year. And of course, a lot of RNs are like, I make more than that. We're not talking about working an extra shift every week. That's the thing RNs are notorious for doing, and I did it too. You want to calculate in your normal salary with you picking up like 55 hours a work week, you know, and doing like night call and, you know, trying to work weekend shifts where you get paid higher and stuff. So you can work your angles as an RN and definitely boost your salary up. And I did it, other nurses do it too. This is talking about you work your normal 40-hour a week work week. You're not picking up extra. You're not, you know, busting your tail trying to work those angles. You're just making normal salary. And I will say, for a bachelor's degree, and especially for an associate's degree, this earning potential is very significantly high. You can make more in this kind of, I don't think there's any other associate's degree I've ever heard of that could potentially make six-figure incomes. And as an associate's degree in nursing working in California, you definitely can. And the same for a bachelor's degree. I mean, I have friends with bachelor's degrees who are working at Starbucks as a barista, you know, making $12 an hour. So for this kind of salary for being an RN is pretty awesome. Of course, I will say, as someone who worked as an ICU nurse for 4 years, there's a lot of work that goes into this. There's a lot of stress, and it takes a toll on you, even from like your soul, it takes a toll on you. So I'm not saying that this is just like free money, go run out there and get this degree because it's so easy and simple and high pay. It's very stressful, lots of responsibility, and it's definitely a calling. But if you happen to line up with this being your calling, good for you. Next step up the food chain and pay scale chain is nursing educators. This is going to be a Master's of Science in Nursing, and they are going to make around $91,000 a year. Now, there actually is currently a shortage of nursing educators in the US, and the reason for this is there are not a lot of because to be a nursing educator, you have to first be an RN. You have to have experience working clinically, and then you go back and get your Master's of Science in Nursing, which is more of like an educator type courses, and it's more like nursing theory, and it's more preparing you to be an educator than anything else. Those courses, once you get done with all of that and you pay off the student loans from that, Then you get out and you go into, work as a nursing educator and say you make $91,000 a year. It's different from being a bedside RN who, like before I was telling you, can like pick up an extra weekend shift or try and take on extra call, really bust their butt and work like a 16-hour shift one day and like rack up a bunch of overtime and stuff. In that kind of role, you can boost your income significantly as a bedside nurse. Whereas when you're like a salaried nurse educator, your set rate is your set rate. Like that's what you're getting paid that year. And they don't care if you spend a bunch of extra hours grading papers or you spend extra long in lecture or whatever you do, you're not getting paid extra for that. You're just getting your set salary. So a lot of nursing educators, they either choose to just do that, and which means they're probably going to take a pay cut or at least not make as much as they could have made as an RN, or they're going to do their full-time educator job, which is pretty extensive, and then go and work an extra shift on their off day at the hospital to try and pick up extra money as an RN with their RN license. And so they're going to be kind of busy doing that. So I would have to say your earning potential kind of takes a little bit of a hit. Even though you went back and got a master's degree, it takes a little bit of a hit to become a nursing educator. So there's not a lot of nurses who want to do that. And there's more time commitment. Once you become a nursing educator, it's not just you have to be here from 7 a to 7 p and then you get to go home and not think about anything and not have to be connected to the hospital and you're totally off. When you're a nursing educator, you're tied to that, university, you're tied to those students. There will be times where you're at home grading papers and doing things in your free time related to school. So your actual time commitment is going to be more extensive and more involved as a nursing educator. But if you want to be a nursing educator, you like the idea of having summers off and Christmas break off, and you don't really necessarily want to deal with working with patients too much anymore, and you want to be part of the people influencing future students and stuff, that's a great option, and you should do that. And one caveat to this, you can get your PhD or your DNP, which is a doctorate in nursing practice, and be a nursing educator, and they usually make a little more than that. And I will say, if you are a CRNA School program instructor, you definitely make significantly more than that, because they have to compensate you for your potential earning that you would make clinically that you're not making because you're working academically. So all the CRNA School program instructors, which also they all have their DNPs, they make significantly more than $91,000 a year. So I'll say that is the only difference in when I say nursing educator. The next specialty up that earns a pretty decent salary is nurse midwife. A lot of people don't seem to know about this specialty in nursing, and it's kind of more like an underground area of APRNs, but there is a such thing as a nurse midwife, and it's a master's degree. And payscale.com says their average salary is $102,000 a year. I would think that would be low, but I personally have never met a nurse midwife, and I don't actually know what their real life salary might be, so I'm going to take PayScale at its word. It seems to be fairly accurate with the other numbers here. So yeah, $102,000. What a nurse midwife is an APRN version of an OBGYN. So nurse midwives are, like I said, it's a master's degree education. They manage patients who are, needing obstetric needs. Maybe they're, of course they're having a baby, things like that. Women's health, they work in those kind of areas. They deliver babies. A lot of times they'll work within hospital systems. Sometimes they collaborate and work with OBGYNs. I think other states they might work totally independently. I'm not 100% sure on their details. But yeah, if you really want to if you want to be a nurse but then want to go back and get a master's degree and do more of like advanced OBGYN type stuff, that would be an ideal career field. The next one up is the famous nurse practitioner. Nurse practitioners, or certified registered nurse practitioners, their full title, CRNP, is a master's degree, but they also have a doctoral offering now. So you can get your doctorate in nursing practice as an NP, or you can get your master's of science in nursing as an NP, either one. There's no mandate that says you have to do one or the other. Their salary average is $109,000 a year, and that seems to be about accurate. I know some places make a little more than that, but I also know other places that make less than that for sure. So yeah, seems to be a pretty fair median of the salaries, and a lot of people know what an NP is. And a nurse practitioner is a advanced care practice nurse who can specialize in acute care, gerontology. They can specialize in mental health and do more of like mental health advanced practice, where they are like a kind of a therapist, and they deal with more of that type of psychologist, psychiatric area of nursing. You can do family practice, where you actually own your own practice as an NP, and you can see all your own patients in the clinic for coughs and colds and diabetes management and hypertension and all that. You can work in like the CVS Minute Clinic as an NP, and you can just see a lot of patients in that setting. There's lots of flexibility with NPs. I've seen NPs who work in administrative roles, things like that. So there's just lots of stuff you can do as an NP. It's very versatile. There's I think there's a few 100,000 of them. And so they're becoming more progressively more and more politically powerful and more autonomous throughout the nation. So, and they're also a very cost-effective, very high-quality offering for medical management of most patients. So if that's something that you're interested in, definitely go for it. I have some friends that are NPs. I actually had one friend who dropped out of the CRNA program and chose to do NP instead and is very happy now. I know a lot of you guys who follow me are like CRNA all the way, and you don't really want to consider other options, but there are some of you who may do better as an NP and prefer that lifestyle. Next one up is Chief Nursing Officer, or called CNO. For short. Now, a lot of people know these, especially if you're a nurse, because pretty much all hospitals are going to have a chief nursing officer. This is pretty much like if we were a military branch, this is like the highest chain of command that's up here. Your CNO is up here with your CEO, and the other, like the CFO, the chief financing officer, and they all kind of collaborate up here. And there's like a chief medical officer up here too, and they're usually all in the same meetings. They're dealing with trying to manage an entire hospital system. The chief nursing officer's role is very much administrative leadership. Their job is to spearhead the way that the nursing field at their hospital is being ran, the policies that are going on. They pretty much are managing all the managers who manage all the nurses. So that is almost always a DNP. There have been some people who I've seen who have an MSN who are possibly working on their DNP, but pretty much to be in a very high administrative role in the year 2020, it's going to be expected that you have a terminal degree, and so that's going to be your DNP. And so or a PhD possibly, but usually a DNP. So if you really want to work in leadership, these people don't do direct patient care. They're like executive leadership. So if that's kind of the role you want to be in, lots of meetings, things like that, you don't just like apply for that position out of nowhere. You have to usually work your way up, usually through the management chain, to become a chief nursing officer, because there's lots of leadership and management type skills that you have to develop over time before you're over such a large spectrum of things. But they average a salary of $128,000 a year. That's pretty good. That's pretty high for the general population. So if that's something you're interested in, definitely head that path. And last but not least, at the very top of the food chain, in the pay scale chain, is my personal pick for best career, which is a certified registered nurse anesthetist, or CRNA. It used to be a master's of science in nursing. It's now a doctorate in nursing practice requirement. It is the only nursing specialty that requires a doctoral degree now to practice, to graduate and have practice, to go into practice. And so I'm a CRNA, and I love this field. I love this area. And one thing that doesn't hurt about my specialty is that it's by far the highest paying. In payscale.com, let's do drum roll, $186,000 a year. That's pretty accurate. That is averaging in the lower paying states with the better paying states, and giving a good median number there. Definitely people make more than that. I make more than that, full disclosure. But I also live in California, so it's expensive here. So CRNAs, hopefully if you've watched my channel and you've been around and, hit that subscribe button and hang around and, listen to my videos in the future, all about CRNAs. But for those of you who maybe don't, a CRNA is an anesthesia provider. So we provide anesthesia for surgeries and for ladies who need an epidural for their baby, for labor pains. We do pediatric anesthesia and cardiac anesthesia and neuro anesthesia, and we do pain management in some places. We do outpatient anesthesia in ambulatory surgery centers. We do GI sedation anesthesia. We do sedation for eye cases and maybe an eye clinic for like an oculoplastic surgeon. We do sedation for plastic surgery offices. Maybe you live in LA and you do, a lot of plastic surgery anesthetic cases every day in that office. We do a wide spectrum of a lot of things, but they essentially all revolve around anesthesia. And so that's what we specialize in. And if you like that field and you want to come into this field, it's super easy. You just need a bachelor's of science in nursing. You need a 1 year of ICU experience, but most of us who get in have 3 years. You need your CCRN certification. You need to do well in your GRE. You need a high GPA from undergrad and A's in all of your sciences. You need letters of recommendation. You need to interview well at the program and impress them. And then you need to survive 3 years of hell of CRNA school. And then you get to say you're $200,000 in debt from how expensive the schooling is. But then you get to be a CRNA and you get to earn that salary. So hopefully that gave you guys a good idea of the different specialties in nursing, the different areas that you can work in, how much money nurses can make, kind of what the different roles are like as far as my understanding is within the field. I want to hear from you guys below. What do you want to be? What's your goal? Do you want to be one of these at all? Or are you like, forget this, I'm going to go be like a perfusionist or something, or I'm going to do respiratory therapist instead. There's definitely lots of areas in healthcare that are great and respected, and they make good salaries too. But today's video is just about the nursing field. So I want to hear from you guys below. Hit me up down there. Let me know what you think. Follow me over on Instagram. It's BoltCRNA over there. Join the membership in case you're not already on there. I'd love to have more of you guys involved. Subscribe to my channel, of course. Until next time, that's Bolt out.